Thank you all for coming out to get the latest on the continued interest and concern about coronavirus. We've been having lots of meetings and community gatherings about this, so the purpose of today is to update everybody on what's happened in the last 24 hours and generally since this crisis has come to our country here. I want to welcome Councilwoman Paula McCraney with us here today. We appreciate the help of the council as we go through this process here. So an update, Louisville still has only one case of COVID-19, although we anticipate that could change in the coming days if our cities, like any of the other cities around the country right now, and we have been preparing for that inevitability as we prepare here for what's going to take place. Some additional information that's been reported by the governor this morning is that our one case here is an individual who's in isolation at Norton Brownsboro Hospital. He is a 69-year-old man, and it has been reported he's a traveler. And what we mean by that is this is a person that's been moving around the country, maybe outside of the country as well, as opposed to just community spread. So that's some more information about him. There have been reports of an individual who was at a conference in Louisville last month. The conference was held at the Omni Hotel. The early reports had said that he had tested positive for COVID-19 when he returned to Washington, and the concern is that he was infectious when he was here in Louisville. We have learned, fortunately, in the last 18 hours that this person was not infectious while they were in Louisville. We received confirmation on that from the Washington, D.C. Health Department last night. Statewide, we are now at 6 confirmed COVID-19 cases in the Commonwealth, 3 in Harrison County, which is close to Fayette County, 2 in Fayette County, and of course the 1 here in Louisville. All 6 remain in isolation and are receiving care. As I said yesterday and will continue to repeat, the number one job here at Metro government is to protect the public. So every decision we make about COVID-19 will go through the lens of public health and public safety. And so that's why we have been planning and preparing and in daily contact with the CDC, Governor Beshear, the State Public Health Department, our local health care providers as needed, and my office has also been in contact with the White House Department of Intergovernmental Affairs. Yesterday, we worked with Louisville Metro government officials to review our internal operations and to ensure the safety of public areas where they interact with the government. Earlier this morning, we had a session with external partners, probably some, I would say 70 or 80 people in this room, to share what we know, hear questions from them, talk through their plans, and address any outstanding issues. And those external partners range from schools and faith leaders to nonprofits and members of our business community. We've also encouraged everybody, and I'd like to do it again, there's been a lot of progress yesterday, for all businesses, any community gathering places, houses of worship, to go online to louisvilleky.gov, print out the COVID-19 bulletin that we have. So if people are saying, what's something I can do to make sure those that I contact have the latest information, you can post this COVID-19 bulletin, and it just goes through the basics of staying safe during this process that we will review during this press conference here. As this situation continues to evolve, we will obviously continue to give guidance to the community. Dr. Sarah Moyer, the Director of Louisville Metro Government's Department of Public Health and Wellness, will share that updated guidance now. Dr. Moyer.
So first, before I share that guidance, I've been getting a lot of questions, as you can imagine. So I just wanted to share a few definitions just to make sure everyone's on the same page. So transmission of COVID-19 or the coronavirus is typically spread through tiny droplets of saliva or mucus carried in the air for up to 6 feet when an infected person coughs or sneezes. Viral particles may be breathed in or land on surfaces that people touch and may be transferred when shaking hands or drinking with someone who shares the virus. So that's why it's really important to wash your hands. We'll keep saying that. Please wash your hands regularly and try hard to avoid touching your mouth, nose, and eyes. It's also really important why we're recommending coughing and sneezing into a tissue or into your elbow to try to decrease that 6 feet that it can spread. And also really important to why we're asking people to avoid handshaking and use that favorite elbow bump instead. Also, yesterday I mentioned my team is following up any close contacts of any of the cases that become positive. Close contact means that you've been within 6 feet of someone for more than 20 or 30 minutes, if not longer. And so if you hear that you might have been in the same airport as someone that might have had coronavirus, please be reassured that the risk of you getting COVID-19 is very small. Social distancing is also a term that we've talked about quite a bit. Social distancing simply means to keep yourself away from people, especially large crowds. And this is really especially important for those at high risk of getting serious illness from COVID-19. Older adults and travelers with underlying health issues should avoid situations that would put them at increased risk for more severe disease. So this entails avoiding crowded places, avoiding non-essential travel, such as long plane rides. And that's precisely why we're also advising that no visitors at nursing homes right now. Older people, especially those with underlying medical conditions, are most vulnerable to the serious disease of COVID-19. And just as we saw coming out of Washington, we've been able to learn from best practices. Majority of their deaths are coming from nursing homes, and so we really, really want to protect our loved ones that are in nursing home, long care facilities right now. And I know families may not be able to see their loved one as a real hardship, but right now it's really the ultimate act of love to try to keep them safe. I know at least with my grandparents, FaceTime, Facebook Messenger are all great ways to still socialize with them, but by maintaining that safe distance. I've also been getting a lot of questions about school closures and event cancellations, so let me share some guidance that we're recommending. School closures currently not recommended, but we'll be considering on a case-by-case basis with the most up-to-date information about COVID-19 and may include the following. So the level of disease that we're seeing in community and schools, we're asking all schools to regularly monitor student attendance. So even though we might have numbers of cases, but if we see a lot of students absence, that'll help us pay attention to the trends. Also disease severity, the number of people who are sick or hospitalized and death rates in Jefferson County. And then the impact that we're seeing the disease has on vulnerable employees and students or those at high risk from COVID-19 complications like those with chronic medical conditions. And then also the ability of the schools and other buildings to be able to maintain proper hygiene and those custodial services that we keep preaching on as well to decrease the disease burden. For businesses, I'm currently not recommending that they need to close, but as Governor Beshear has mentioned, really encouraging businesses to implement policies so sick employees do not feel like they need to go to work when they are sick. We're also asking all employers to post the information flyer that the mayor mentioned, which is found on our website. For events, if you're hosting an upcoming event or gathering, please make sure you're reviewing the CDC event guidance and consider other community guidance given to the general public. So please make sure you're providing hand washing capabilities, hand sanitizers, tissues, soap and water works great. And then frequently cleaning high-touch surface areas like countertops, handrails, doorknobs. And then also find ways to create physical space to minimize that close contact that I mentioned earlier. We're also recommending postponing events targeted at populations over 60 or those with chronic medical conditions. If you're going to a community event, we recommend that you do not attend if you are sick, do not attend if you have chronic medical conditions or are over 60, and then please keep washing your hands. Soap and water is best, hand sanitizer if that's not available. And find ways to create physical space to minimize close contact as much as possible. So Louisville Metro Government and our team at Public Health and Wellness will be evaluating the following key factors surrounding large events and mass gatherings: the likelihood for extended close personal contact, crowd density, the number of travelers from areas currently experiencing person-to-person spread of COVID-19 domestically and internationally, the number of guests coming from unknown locations, and the ongoing lack of vaccine and limited treatment options to be able to manage if lots of people got sick. So before I end, I just want to reassuringly that we're seeing that majority of people who do get COVID-19 have very mild disease. And so right now, testing capacity, because it's been slow to ramp up, we're only able to test those that are seriously ill in the hospital, or those that have been close contacts or of travel that the CDC, travel guidance that the CDC is recommending. So please, if you think you might have COVID-19, you can call your healthcare provider for advice, but right now just recommend staying home and staying away from friends and family members if you're not sick enough to need to go to the hospital, but please go to the hospital if you are. So I'm going to turn back over to the mayor. Thank you.
Thank you, Dr. Moore. Next up, Amy Hess. She's our Chief for Public Services. Amy?
Thank you, Mayor. Good afternoon. As we find with any events of concern, communication is key. And not just any communication, but timely, accurate, and clear communication, both within agencies or entities or groups and between those agencies and externally as well. So as the mayor mentioned, on Monday, yesterday, we started with communication within our departments, across our department leadership, and across Metro government senior leadership to share information, to share best practices so that we could come together and talk about what we're doing internally within each of those departments. We also, of course, had consistent communication from public health and also allowed our employees an opportunity to ask questions and share concerns. Today was a follow-on to that conversation. Today we invited our external partners, so many agencies and entities and groups from across Jefferson County and beyond, to be able to come here today to learn more, to hear that consistent guidance, that consistent communication from public health, and to share best practices of their own, and to ask questions and share their concerns as well. Clearly, moving forward, we need to continue that. And on Thursday, we will be having an exercise where those same individuals from yesterday and today will be able to come together right here in this room so that we can practice what we talked about yesterday and today and to practice those plans. As with anything, practice makes perfect. And even though you might have the best plan, you've got to exercise it. You've got to practice it so you know what it would actually look like and feel like and sound like if it actually happened. And so the intent of Thursday is to bring in all of those partner agencies and all of our internal departments so that we can exercise those plans and practices and talk through their concerns and questions that remain. Thank you.
Thank you, Chief Hess. We're going to hear from a couple of our community partners right now that are dealing with a lot of moving parts. And so first up is Karen Williams. She's the Chief Executive Officer of Louisville Tourism. Karen.
Thank you, Mayor. Good afternoon. I've talked to many of you over the past couple of weeks, but those I have not shared, I'll reiterate some of it. I will say 2 weeks ago, when we were hearing about this in our travel industry all over the country, we established webinars with all of our national associations so that we could share the best practices with all of our clients and visitors coming in. 2 weeks ago, we sent out a communique that included the links of all these national associations, including U.S. Travel Association, the President Roger Dow, that works directly with the White House for travel situations. We wanted our visitors coming in, whether it be a convention or a leisure event, feel very comfortable and safe. We've shared these communiques with all of our hotels and our partners, which our partners mean our attractions, taxi, TARC, anything that you can think of a partner here in Louisville. Then we decided that we needed, as this week progressed, that we're actually reaching out to our clients. We're reaching out to our clients that have a convention from today all the way for the next 45 days. And what we have done is prepare a communique with working jointly with Louisville Tourism and Kentucky Venues of things that we're doing on the trade show floor to keep their attendees safe. And they include regimented cleaning procedures that utilize products capable of combating the disease, additional hand sanitations areas placed throughout each venue in high traffic areas, and postage and signage with CDC guidelines all throughout their show floor. I will tell you to date, and I've had many questions from the media, have we had any conventions or events cancel? To date, we've had a few cancel call us, and it's literally been within the last 36 hours. We will be able to provide probably in the next few weeks the names of those conventions. I will tell you they're all occurring within March or the first week of April. And the reason that we can't divulge their names now is they're in negotiations with the venues as well as the hotels and contractual issues. Because there is no U.S. travel saying you can't travel in the U.S., they are all subject to cancellation charges. But our goal is to rebook them for the future, so that is why we can't say their names. These communiques that I've talked about for all of our partners and our clients will be updated on a weekly basis and shared with the mayor's office. Thank you.
Thank you, Karen. Of course, we've got the Kentucky Derby season is upon us. I misspoke yesterday with the wrong number of days before the Derby. We are at 53 days before the running of the Kentucky Derby, and we're 38 days before the beginning of the Kentucky Derby Festival. So to share some information on that, Matt Gibson, the CEO of the Kentucky Derby Festival. Matt.
Thank you very much, Mayor. As the mayor said, we're 38 days out from the core of the Kentucky Derby Festival, and with the advantage of time, that's an eternity in our industry. We're looking at everything that we do, from the enormous events like Thunder all the way to the smaller events that would have about 2,000 or so attendees and everything in between. We've been working for a few weeks on this. We set up our own internal COVID-19 task force in order to sit down and reach out to all of our industry partners and monitor their best practice so that we can evolve ours. We have very extensive emergency action plans, and we've been working very closely with the folks here in Metro government and in state government as well to have conversations about how we would implement things a little differently, especially when you're talking about the challenges that this particular issue creates. So we'll be monitoring and staying in daily discussions with folks like Metro Health, Metro Public Safety, and those to evaluate our events. We'll be issuing communications out to folks, and we'll be monitoring on a day-to-day basis. I know that we've had a lot of questions from you all, and we're doing our best to answer those. But again, we'll be working in conjunction with the teams here and the people that we've always worked with in order to monitor those events and keep people in the know. So, thank you.
Thank you, Matt. And last is Reverend Eric French with the Interdenominational Ministerial Coalition. Obviously, we have a lot of people gathered at our houses of worship, so we appreciate Reverend French being with us here today.
So in our house of worship, what we're trying to do is make sure that we're keeping up to date with everything that's taking place. We're having conversations about how we would do prison visitation, hospital visitation, nursing home visitation. We pride ourselves on helping others, but we want to be wise as we do that. We are trying to supplement our faith with facts, and we're also trying to have the difficult conversation with those over 60 and in risk factors. We want to help them process when it is appropriate not to come to our house of worship. So I applaud the mayor and his staff for making sure we have information, especially the flyers that are available to give out to our seniors, because a lot of our seniors are not internet savvy, so we are going to have to hand things out to them physically. But the key thing is to make sure we give out appropriate information in a timely fashion. So thank you, Mayor.
Thank you, Rev. Just a couple of things. Yesterday, we received quite a few calls here, people upset about the guidance we're making around senior living facilities. So as Dr. Moyer said, we just want to drive this. All of these suggestions are being driven by facts. You know, we know in the state of Washington, which is kind of the epicenter of coronavirus outbreak for our country right now, the epicenter within there is a senior living facility that's had 19 deaths in that facility. So we know this is a problem. It's a high-risk population, obviously with some underlying factors. So that's the reason why we're putting the guidance out here locally. The governor has done statewide as well. So I realize you might be upset with this, but all we're trying to do is keep your loved one healthy and keep you healthy. So we'll work through all this, but that's the data that's driving this recommendation. So for some next steps, we've been working with our Metro Council partners, and on Wednesday, Dr. Moyer will be giving them a full briefing with the latest updates. Several of them have been involved with the different activities we've been doing so far. Also on Wednesday, the White House is hosting a call with local governments and we will certainly be participating in that call. On Thursday, as Chief Hess mentioned, we will be hosting an exercise with our external partners, and we'll invite the media to hear a summary of the lessons learned during that exercise. And then we will continue to hold daily briefings to keep you, the media, and the public informed. One thing I want to reiterate is that we're asking all businesses, houses of worship, and public facilities to once again post the flyer, which gives guidance on how to protect yourself and others. And so, not to be a broken record, because we all want to be able to give this, there are simple but powerful steps to keep yourself and others safe that we need to keep reporting. So, number one, what is the most important thing everybody can do? Wash your hands, right? For 20 seconds, which is how long it takes to sing the happy birthday song twice. Ray Zhao and Dr. Sarah Moyer, their birthday is today. So if you don't know of anybody whose birthday is today, put in there, Dear Sarah or Dear Ray. Okay, that'll take care of that. So that's number one. And, if you don't have hand sanitizer somewhere, warm water and soap is best. Avoid touching your eyes, nose, and mouth. Cough or sneeze into your elbow or a tissue, and if you do it with the tissue, then throw it away. Avoid contact with sick people and stay home if you're sick, because that's super critical, right? If you're feeling not well at all, please stay home. And rather than shaking hands for the time being, let's greet each other with a little elbow bump so that we don't pass anything that we have on our hands. So these are just some of the same principles, right, that we all know what to do with the flu as well. And there are countless examples or countless instances of the flu going on right now that are much more severe than the coronavirus, although there's a vaccine for the flu. We're also want people to be alert to price gouging on items that are hard to find that are related to this coronavirus concern. So if you need to report price gouging, please use this number, 888-432-9257, 888-432-9257. And then last, for definitive answers, don't go to social media, okay? Go to this website that you see up on the screens, KYCOVID19, kycovid19.ky.gov, or you can call 800-722-5725. Okay, so let's all stay informed so we can do the right things and stay calm as we work through this. We'll get through it. So with that, we're happy to take a few questions. Yes,
related to the case here in Louisville, were others who were traveling alongside that patient on the flight, were they informed, and are they now being monitored or evaluated in any way?
Right. Dr. Moore, you want to take that?
Yeah.
So that's all part of our investigation. We send the flight numbers and the list to the CDC, and they get in contact through the airlines with everyone who would be possibility of being a close contact.
So we don't know yet, basically.
It's outside of Louisville, Jefferson County, and so we pass that information on the CDC to follow up. Yeah.
But are those domestic flights or those international flights?
Sorry.
Are those domestic flights or those international flights? People are still wondering, and more communities have been releasing more information about their patients at this point.
Yeah, so that's all HIPAA information. So we, the big thing is that we will call you if you're in close contacts. If you get in a phone call from the CDC or the health department, please answer. Please give us the information that we need to evaluate whether or not you're at risk for it or not.
But just to be clear, we're not aware of anyone else in Louisville at the moment who was on that flight.
Correct. Correct.
Sorry, go ahead.
Without violating patient privacy, what do we know about how this person got to Brownsboro? Did they have advance notice? Did they go to urgent care? Was there an ambulance?
All I can say is that we are following up. We have all that information, and if you are affected by that, we will be contacting you and following up with it. So if you have not gotten a phone call, if you have not known, then consider yourself low risk.
With other communities releasing more information fairly quickly about some of their patients in Kentucky and Indiana, how do these questions violate HIPAA? How do these questions violate patient privacy?
So, I mean, I think looking at other examples, we promise to release information where we don't know exactly who the contacts are. So in situations like the Walmart in Kentucky, they release that because they don't know exactly who was in the store and who was around that. In our situation, it's different. So it's case by case. If the public needs to know, and if we can't follow up directly, then we will release that information.
Did this flight come into SDF that this man was on, or if he was a traveler, did he fly into SDF here in Louisville? Because that'd be another situation where the people wouldn't be specific, right? Yeah.
Yes, but since it was a outside Jefferson County flight, the CDC follows up on those cases.
Or SDF here in Louisville? Because that's in Jefferson County.
Yes, I will need to consult with my epidemiologist. I don't think he's here, but yes, the nuances are very difficult to answer. But since the CDC tends to take care of the whole flight information with the airline industry on contacting those patients.
You were aware of his movements after he arrived in Louisville? How long was he sort of in the community before he went to the hospital?
Yes, we are aware of all that information and have followed up with people that are close contacts.
You may have questions not about this case because we've given you the information we can give you right now about that case.
I mean, I think people are wondering whether this person went to the store or, you know, if they might have encountered him. If that's something that you can confirm didn't happen, that might, you know, reassure people, I think.
Yes, so by default, since we have not released any press releases about having to avoid a restaurant or a store or any certain place, the answer to that is yes.
Thank you. Concerns about the economic impact this could have. Ms. Williams told us that they've had a few events that have been canceled. People are wondering about the big events, Derby and Thunder. Any worries that this could impact more than just public health?
The only criteria we're making these decisions on is public health. There could be some downstream economic implications, obviously, but that is very secondary to our concern for a safe city and certainly any kind of loss of life.
You mentioned deep cleaning ambulances yesterday. We brought up TARC today. What's being done for the public transportation aspect of making sure that people feel comfortable using TARC?
Yeah, TARC was at our earlier meeting here today. They're doing deep cleaning procedures for their buses and washing procedures for the buses as a standard operating procedure now.
Like daily?
That was the indication earlier today, yes, daily.
Twice a day.
Pardon me?
Twice a day.
Twice a day.
Today, okay.
So we've talked about events like Thunder and Derby. When they are close, they're not quite as close. There's another big event that we have this weekend, which is the St. Patrick's Day Parade. So has that been something that you all have discussed, or do you think that that decision will be made closer too? Because we just keep getting inundated with people who are asking us questions about it.
Yeah, we want people, so St. Patrick's Day Parade, as of right now, is going on as scheduled, but we'd want people to take the same kind of precautions when they think about attending that as what has been advised already. So if you're over 60, if you have underlying conditions, if you're sick, stay away. When you're there, hand bump or elbow bump. So just the kind of same kind of guidance we'd like to say. Now, also remember when we look at these different events, I mean, all the events are different, right? So you have, let's say, an indoor event with close proximity. That's very different than a big outdoor event without close proximity. So those are some of the factors we take a look at here. All this could change, but as of right now, the St. Patrick's Day Parade is a go-ahead.
Any recommendations on church services? You know, a lot of churches hold services tomorrow on Wednesdays. That's obviously a small space where a lot of people pack in. Any concern about those services?
As you heard from Reverend French, remember we've got one case here in Louisville. So again, if you're over 60, chronic conditions, you know, feel sick, don't go to church. Don't go to your house of worship.
One more question?
Just a question about Metro Corrections. Is video visitation the only option at this point? And also what types of sanitation options are available to the people there?
Yeah, the corrections and are going through an upgraded protocol, if you will, in terms of cleaning, like everywhere. That happens when we have flu outbreaks and things like that within the correction. So relative to visitation, we do anticipate kind of the same type of restrictions to be put in place on corrections in the jail is what we're putting guidance out now for senior facilities. I'm not sure if that's in place at this moment, but naturally we're going to try to have that same type of precaution there. Okay, thank you all for covering this.